I declare this ground open.
The day ground was broken for a brand new hospital in northern Ghana was a miraculous one for so many who had both dreamed and worked tirelessly for this day to come.
And so that day, I was walking on clouds. They came in their numbers to just sing and dance and to encourage us that they are on board with us.
We just have so many partners, so many people who have just passionately accelerated every aspect of this project that honestly we just can't believe we're here.
Leyaata Hospital, slated to be open in 2021, will save thousands of lives that have been in serious peril due to the chronic lack of healthcare resources in northern Ghana.
They are lacking things like clean water. They don't have latrines, some of them. We go into places and there might be one healthcare provider who's serving thousands of people.
Where is your medical store?
Store.
Store?
Yes.
There's just absolutely nothing to look after.
This is where I examine the pregnant women
Okay.
when they come for antenatal
Okay.
visits.
They don't have the resources they want and they need to provide healthcare. It's incredibly frustrating.
For more than a decade, annual trips to Ghana have been made by passionate healthcare workers from Canada, the UK, and other parts of the world. They've been a vital source of training and encouragement for local health practitioners and have poured their hearts into helping stem the tide of needless deaths across the region.
This team of leaders have gone, some of them have gone 8, 10, 11, 12 times, pay their own way year after year to lead these health teams.
The difference they've made and the lives that they've served, but always with that view that we need this 52 weeks of the year. And to know that life after life that we've even seen lost in those years in between will no longer be lost because that healthcare will be at their doorstep.
The health teams have also played a vital role in laying a foundation of research for the new facility.
The data that we've been able to collect has made us be very selective on what needs to be in this hospital. We know the emergencies, we know the hernias, we know the maternal and child health needs. We know exactly what is needed for that area.
No stone has been left unturned in planning this innovative facility, which includes its own village and good schools and accommodations that will draw local doctors and nurses, many of whom have already received scholarships and completed their education. A plan is in place for this model facility to become self-sustaining within 3 years.
It'll be a place of sanctuary where people can come and trust that they're not going to die while they're there. They're going to get good care. They're going to be treated compassionately. And I just think it's a message that will inspire them then to go out and do their part in their communities.
I love the name, Leyaata, which means rescue us. And I think it says that the God who rescues us all cares, that they matter, that their children matter. And I think, I get a bit emotional about it, but it's just so hopeful because their cry has been heard.
Thanks to the generosity of so many, all necessary funds for the buildings have been raised and construction is underway. And that's huge reason for celebrating, but it's just another building until those doors are open. And that can't happen without full funding for medical equipment, IT, and life-saving supplies.
We have the last, chunk of our capital campaign to raise, and we're all out pounding the pavement, just looking for ways to just reach our final target. As you can imagine, hospital equipment is very, very expensive. So there's much work to be done, but if we can just get the capital campaign finished, then we can just go full steam ahead.
They are going to contribute to a project that does not cut corners. Anybody who wants to give money to this project, they have found the best project to give money to.
We have come so far, but we're not quite done yet. In order for this to be a fully functioning hospital, all the right tools must be in place. Buildings completed, staff trained and committed, equipment purchased and in place, stock rooms fully supplied, and doors open, ready to serve. That's the finish line. Will you help us to cross the finish line?
Something big, something bigger than a hospital, really, that is taking place. And I just want to say to the supporters that bravo, that thank you to them, Janjam, for what they have done over the years.